Okay, welcome back. So now we are on page 236 talking about medication interactions and side effects. Medications can be used for positive benefits. They are used, presumably. They can ease pain, lower blood pressure, improve mood, soothe rashes, reduces fever, kills germs, cures infections. Lots of things they can do. But medications, when used improperly, can also cause serious harm or death. To prevent negative side effects, home care aides have to understand the basic ideas of medication interactions and the side effects that come with them. Okay? Interactions, let's talk about that first. Medications, whether prescription or OTC, or legendary drugs, remember, they can interact with other medications, or sometimes food, alcohol, vitamins, or herbs, or remedies, or things like that, supplements. These interactions increase or decrease the effectiveness and or the side effects of the medication. They also can cause some serious side effects as well that can lead to hospitalization or death. The more medications a client takes, the more likely an interaction between those medications is going to occur, because each ingredient in each medication has the potential to interact with another ingredient in another medication. And when you're adding in long lists of medications and long lists of ingredients in all those medications, the chances of one of those things having a bad reaction with one of those other things obviously increases because there's more things in the mix. The more ingredients you put in the brownies, the more likely it is two things in that brownie mix won't mix. For example, make sure you're reading the label that comes with the medications, because sometimes if there's a significantly severe reaction, the label will have directions on there, like do not take with food, do not take with grapefruit juice, do not take with Advil or Tylenol or ibuprofen or something. There'll be instructions on there if it's something that would be like serious and not at all well known. Oftentimes the doctor will have discussed with the client things that they're not supposed to take with the medications as well. And hopefully that information will have been conveyed into the care plan. But if not, then, talking to the client is your next best thing. At the end of the day, you do the best you can with the information you have at your disposal. If something happens that you weren't aware of and couldn't be prepared for, nobody's going to blame you for this. But at the end of the day, you have to do your due diligence and do what you can to figure out, okay, they're taking this med, they're taking this med. Are these two meds okay to be taken together? A good rule of thumb is if they're already taking these medications by the time you arrive, and they've clearly been taking them for a long time, then there's not likely going to be an interaction between the two medications. But if they're having a new medication added, or they suddenly tell you, oh, I went on to eBay and I bought these pills on eBay to help me with my blood pressure, then you probably want to do a little digging and figure out, well, you're taking 3 other medications right now. We should make sure this isn't going to interact some way with those medications before you start taking it. All right, that's more what I'm talking about. Let's see, what else? Okay, so now let's go over to side effects. Okay, side effects. This is on page 237. And the side effects of medications are not really normally part of the positive effects that take place. I mean, I rarely ever hear about a side effect that's a good thing. I'm sure there are some good side effects. If you know of any good side effects to medications, let me know. I'm curious about that. But usually people who are older or people who have certain diseases are more likely to have side effects, just because their overall resistance stat is a little bit lower. Part of the home care's job is to observe and watch for side effects of medication, especially if it's a new medication. Like I said before, if they've already been taking the medication consistently before you arrived and they've been taking it for years, then the chances of side effects occurring to that medication are extremely low, aren't they? Because they would have been noticed by now. But if it's a new medication or new supplement or something, that's when you really want to be diligent about keeping an eye out for side effects. Okay? Some side effects that are listed below, these are moderate and then they're severe. And you see the list here. You hear them read this list whenever they advertise the medicine on TV, right? It's always these things here. There's always constipation, dryness, fatigue, nausea, restlessness, vomiting, weight gain. You always hear about those. But the more severe ones are when your vision starts to become impaired, or you start to get like diarrhea because your body's it's rejecting that medication. Tremors, or like your face is swelling up. That could be a sign that you're allergic to something in there. So there's more severe side effects as well. You don't have to memorize this list, but keep it close to your heart so you know sort of what to start looking for when a new medication gets thrown into the mix. Now, there can be, as I said, allergic reactions to the medication. Allergic reactions are, as we discussed before, where the body essentially has a reaction, and in a bad way, to a substance introduced into it. Itching, swelling, muscle spasms, the throat and airway tightening. I mean, you can get like annoying to hospitalization to life-threatening. So those are things you want to specifically be watching for. And if you know your client is allergic to something, then you want to be checking the labels of those things when you're getting them ready for the client. So let's say they have a new medication and they're, oh, I'm taking this. All right, cool. So you get the medication and you read the label, you read the ingredients in the medication. And you know that your client is allergic to guar gum, for instance. And right there on the label, third thing down, it says, this, that, sodium bicarbonate, and guar gum. Well, all right, now you know that they're allergic to this and they shouldn't be taking it, right? So then you take steps to make sure that they didn't take it. You'd get the information to the doctor who maybe prescribed it and say, hey, you know your client's allergic to guar gum, right? And they, oh, yeah, gosh, I didn't know. I need to, and who knows? You might be the one that notices something no one else saw. So your eyes, your ears, you're the detective. You're keeping an eye on these things. Remember, life-threatening or allergic reactions that you're concerned about, especially difficulty breathing, that's a 911. Okay? All right, over to page 238 now. Wait. Oh, that's weird. When I flip the page, it doesn't actually go to 238. It goes to 237 and a half. Okay, well, that's the page we're supposed to be on. Yeah, right there. Go down. No, back next page. There you go. That's the one we're on. It's not listed as 238, though. They mislabeled the pages. That's funny. So these are the routes of medication that you're most commonly going to see. There's oral, there's sublingual, and there's topical. We'll go into these more in detail in class, but essentially oral is in the mouth, swallowed. Sublingual is under the tongue and dissolved, and topical is on the skin and absorbed. Okay, so those are your routes of medication. Let's see what else. Okay, there's also rectal. Now we can go over to page 238. Yep, 238. We're on the right page now. Yep. There's rectal, which is into the anus, and there's vaginal, which of course is into the vagina. Inhalation is breathed in through the nose or through the mouth, and injection, which is pop it into the skin through a needle. Okay? So those are the typical routes of medication. I don't have to go into too much detail about them. You just need to understand the differences between them. And with my little definitions I just gave you, you know enough to distinguish between them. Now over to page 239. Medication assistance and medication administration, the differences. There is a legal difference between medication assistance and medication administration. Home care aides need to understand what they can and can't do, legally or not. Okay? And remember, the rules are different for agency providers as opposed to individual providers. Medication assistance is when you're helping them take their medicine independently. That's when you hand them the pill, measure out a container, pour the dose, give them a verbal reminder to take it, maybe hold their hands steady while they're shaking so they can take it themselves, or altering the medication, like crushing up the pill or mixing it into some food for them so they can eat it more easily, or maybe heating it up in the microwave, or whatever you're doing with the medication. So that would be assistance. They can take it, they just need your help. There are some rules about altering medication, though. It's important to know this. With altering medication, it means crushing it up or dissolving it, so it's easier for the client to take. Altering medication must be approved by the person who prescribed the medication in the first place, because this is the person who's going to know if it's safe to alter the medication or not. Some medications have to be altered to be taken. You have a client who has dysphagia and they need to swallow their pills, they're not going to be able to swallow pills, are they? So they'll need to be, altered in some way that they can actually swallow them. Okay, but this needs to be known by the doctor and approved by the doctor before it's done. You don't just do this on the fly when your client asks you to do it. Any altering of medication should be in the service plan. And remember that some medications cannot be altered. If it's an ER medication or extended release, or a sustained release, SR medication. These are medications that are designed to be in the body system for a long period of time, slowly released into the bloodstream, not powdered up and shotgunned into the body for a rapid fire big dose. All right, So we'll take a little break here. We'll come back and we'll talk about when it's required to assist with medications. All right, legally, there are two conditions that has to be met to be considered medication assistance. One, they should be able to perform the last step of the medication procedure, which is taking the medication, putting it on their own skin, putting it in their mouth. They're doing the last step of it. All the prep work can be done by you, but that last step has to be them. And two is they have to be aware that they're taking medication. If they don't know they're taking medication, then it's not medication assistance. That's administration. You're giving it to them without their knowledge. You're slipping it into their food. You're crushing it up into their drink. Or maybe they're not mentally cognizant enough to understand the fact that they're taking a medication. Well, obviously they can't consent to taking it, but they need to take it. So that wouldn't be assistance, would it? That'd be administration. You're putting it into their body. All right? If the client doesn't meet both of these conditions, then it would be considered medication administration, and nurse delegation would be required, okay, for all you agency providers. Medication assistance in assisted living facilities is slightly different. In a licensed assisted living facility, the home care aide will perform the last step if the client can accurately direct the home care aide to do so. So it means you can administer the medication, but it's still considered assistance as long as the client is aware of what's going on and they're able to guide you in doing it. Okay? The client knows what the medication does, they know how to administer it, and they can direct you to do the physical act of putting it where it needs to go. But this is not for insulin or injectable medications. This is for topicals, orals, suppositories, things like that. Okay? So that one's okay in an assisted living facility because it's a little bit different there. This exception only applies to assisted living facilities. It doesn't really say why that's an exception. Let's see. It's written in the law specifically. It does not apply in adult family homes. Okay, it doesn't really say why that's the case, and I truly don't know why they have the exception and others don't. But I'm sure there's a good reason, so we're just going to trust the system. All right, pop over to page 240 for me now, and this is medication administration. Administering medication requires a nurse to perform or a qualified caregiver with nurse delegation, or the self-directed care we talked about. Under nurse delegation, you'd give medications to your client in the way that the delegating RN taught you to do it. In this case, the client could be confused. They might not be aware they're taking medication, or they're not able to perform that last step, which is doing it themselves. There's a number of reasons why you might have to do the medication for the client. It's necessary when the client's unaware of or physically unable to do the medication. And some cannot be delegated. We'll talk about those here in a minute. Let's see here. All right, here's some tasks down here. Some things that do not need to be delegated are opening containers or pouring liquids, putting it in their hand, crushing or cutting or mixing the medication if the doctor says it's okay, or holding their wrist. Those are okay for assistance. For administration, it's when you're putting it in the mouth or applying it on their skin directly. They're not part of the process at all. Or injecting medications other than insulin. That would be medication administration. Then, can this be delegated? Yes, it can, putting it in the mouth and putting it on their skin. But can it be delegated if it's injecting medications? No, it cannot. So who can inject medications? The nurses, right? The nurses. Or can you? Well, if it's a self-directed care task in an independent living situation where the client's in their own home and you're working directly for the client, then yes, that could be a self-directed care task. So, all right, hopefully you got the differences of all those and they make sense. It's pretty clear. Client is unaware or cannot help in any way. It's administration. I hammer this home because this information is going to be on the test. There will be questions knowing the difference. All right, over to page 241 now. 241. The client's rights. The client does have rights when it pertains to medication, taking or not taking. The three main rights that they have are, one, they have the right to choose whether or not to take the medication. It's up to them. That they can be directed to it and revised to it, and it's told that they need to do it, but no one can force them to do it. Two, they have the right to informed consent, meaning they understand what this medication is and what it does. Why are they taking it? And three, they have the right not to be chemically restrained, meaning they have the right to not be given medications that are designed to slow them, make them tired, make them loopy or sleepy or dopey or grumpy or happy or any of the dwarves. They don't take medications to make the caregiver's job easier. Okay? Make sure we're not forcing them to take the medication. Make sure we're not hiding the medication somewhere to get them to take it. Both of these are illegal. You don't do these. These are where you no longer work as a caregiver when people find out you're doing these things. So do not do that. Now over here, we're on the skill of medication assistance. I'm not going to go over medication assistance skill in class because we're going to cover that very well in the actual live portion of the class. I will touch on a few topics here, though, that'll be good for you to kind of put eyes on and see. For example, over on page 242, it talks about the 5 rights of medication, which we will talk about in class. But there's some commonly used abbreviations over here when we talk about the dose. I'm not going to hammer on these in class, but I want to direct your eyes to this chart because you'll commonly see these abbreviations on the medications themselves, whether it's the bottle, the syringe, the dropper, the cream, whatever. And so knowing what these mean, being familiar with them, can help you when you get something on a thing that says what to do. It's like I have directions and it's give 2 GTTS, BID, and you're like, the heck is that? And then you look here and you say, oh, GTTS, that's drops. Oh, so I'm giving 2 drops. Okay, good. It actually comes from the Latin word gota. You know, a lot of these words actually come from Latin roots. It's kind of neat how they did this. So knowing what these mean is important. Now come over with me to page 243 because there's a bunch more abbreviations that you need to put eyes on. This is a good page to maybe take a copy of and keep with you in your caregiver folder as you go work with clients. It's a quick reference that you can use if you ever need to know where you're putting the medication, how you're putting it, how often you're doing it, things like that. So for the routes, oral, rectal, vaginal, we talked about those. They're pretty straightforward. But then we've got these abbreviations, OD, OS, OU. What do those mean? Well, obviously the ocular for O, optic, that's your O. And then you got D, S, and U, which I'm not sure what those actually come out to. PO, per oral, by mouth. SL, sublingual, PR, rectal, per rectal, so you're going to see abbreviations sometimes, and it won't always be obvious what they are. So having that is good. Then you finally got the abbreviations that cover the times. Look at all these. Holy cow. What do these mean? I don't understand. Well, you've got, again, more Latin things like this. So you've got PC, right? So that'd be like post. I don't know what the Latin word for comida, something like that. It's a word that means meals in Latin. But anyway, so PC is after meals. Q is like every. Where do they get that? I don't know. Quo, quora, certainly a Latin word somewhere. And then so we have QD, right? QD is every day. Or we have QID. That's 4 times a day. TID, 3 times a day. BID, 2 times a day. QOD, every other day. This stuff's not obvious. It's not something you would just look at and go, oh, I know what NOC means. Oh, I know what S means. But it's like, if you know Latin, it helps. Like C is for con, with. S is for sin, without. I mean, if you know Latin words, you'll get it. But I mean, who speaks Latin besides weirdos like me anymore? So yeah, there we go. Knowing these abbreviations are good. Okay? All right, over now to page 244. Don't worry, we'll talk lots about medications in class. A once-a-day medication should be taken at the same time every day. Certain medications are taken at specific times, like warfarin, statin drugs, the drugs for the heart and for cholesterol. Those are usually taken in the late afternoon and evening, like the statins, atorvastatin, rosuvastatin, things like that. Medications for hyperthyroidism are taken first thing in the morning and on an empty stomach. So they're rapidly absorbed into the body quickly, and it can sort of prepare the body for the day of taking in food and drinks and things like that. Time frames are unique to the individual clients. So kind of work around their schedules as well. AM for one client might be 10 o'clock. AM for another client might be 6 o'clock. It entirely depends on the client in a lot of ways. So use that as a guide, but not a regimented structure. Okay, good place to stop, take a break. We'll pop back here in just a minute on medicated judgment. Okay, continuing on from the middle of the page on 244. As needed medications and professional judgment. PRN. Oh, they put the Latin in there for me. Look at that. Pro re nata. PRN. Pro re nata. Are medications taken on as needed basis. You may help a client with an as-needed medication if there's specific written directions to follow, and the client says that, yes, I'd like to take that medication. What are some PRN, pro re nata medications? Tylenol, Theraflu, Pepto-Bismol, acetaminophen, anything that's like over the counter that's used when somebody has a need for it. Okay? If a client who doesn't have cognitive impairment asks for pain medication, totally okay for you to get their pain medication for them, right? Now, if professional judgment is required as to whether or not this medication is okay to take or not, you wouldn't be able to do this, would you? This isn't a medication assistance thing. This is a nursing thing. A nurse has to decide when it's okay to take that type of medication. And those will be rare situations. You won't have too often in a client's home where they have a medication that requires a nurse is okay to take, that there's no nurse around to get the approval from in a quick, easy manner. It wouldn't make sense to the home care setting. If a client has cognitive impairment, they're nonverbal, and their service plan does not have any issues on how to do the pain medications, you cannot decide what pain medications to give them. You cannot self-prescribe a medication for a client, even if it's not a prescription medication. I'm having really bad cramps. Oh, okay, here, you know what? Try this. This works for me. I have this in my purse. Try some of that. No, can't do that. It's being helpful. You're trying to do the right thing. I get it, but it's not okay. And if it's found out that you're doing that and something happens, well, who is it all going to fall on? It's going to fall on you. So don't let that happen to you. All right. You think medicine might be good for a client? Nothing wrong with bringing it up to the doctor. Tell them, just say, hey, my client's suffering from a lot of these symptoms that I used to suffer from. I take this. Would this be okay for the client to maybe start taking? The doctor will probably say, yeah, sure, that's fine. Or there might be a reason why they say no. And if they say no, trust me, there's a reason for it. Right? Same thing I always tell my kids. With my kids, it was like, if I tell you no, I will always give you a reason why I told you no. I don't just say no for fun. I'm going to give you a reason why, because I respect you enough to explain to you why the answer is no. People appreciate that. All right, over to observation, documentation, and reporting. As with reporting or performing any care task, you observe, document, and report when necessary. Okay? Observing, that's kind of an all-the-time thing. Documenting and reporting, that's on an as-needed, but still regular basis. For medication assistance, we're observing. We're watching when they took their medication. We're watching for side effects of the medication. We're watching if they didn't take their medication. Those types of things. Documenting and reporting, the rules are a little bit different depending on where you work. If you're in an assisted living facility or an adult family home or an enhanced service facility, you probably are going to have to document the medications taken and refused. They're going to have a set structure, a chart, if you will, that you'll mark down, you'll initial if the medication was confirmed taken, something along those lines. If you work in an assisted living, like an adult, like a client's home, like for a home care agency or something, you won't often be recording the medications unless there's been a problem with them taking them in the past, and recording them has become necessary as part of their regular care. Okay? If there's no specific documentation rules for in-home clients, you don't work for anybody, no one's told you what to do, you're just there doing the medication, it's just a good idea to document drug reactions or possible side effects, or document if they don't take the medication. That's just something to sort of self-document for yourself, to keep your own record. Have a notebook, have a little sketch pad, something like that, where you just keep track of things like that. This way, if anybody ever says, how long has it been since they took that medication? You can look at your thing and say, it's been 3 days. They've been refusing that medication for 3 days. So you don't have to memorize it. Over to page 245 now. What happens when the client says no? Okay, just say no to drugs, right? But not these drugs. We're supposed to be taking these drugs. How about when they don't take their medication when they're supposed to? Now, they have the right to refuse, don't they? Sure they do. They have the right to say, I don't want to take them. but we have the responsibility to try to get them to take their medication. So it's kind of like you need it, I don't want it, I'm going to try to get you to take it, I'm refusing it, and you're just kind of keeping going, trying to get them to take what they're supposed to take for their own health, safety, and well-being. Sometimes they don't want to take the medication. First thing you do is you just maybe get to the bottom of why. Sometimes it's something just simple. They might say, I don't need this, or I don't want to take it, or it upsets my stomach, or I'm taking too many pills already, I don't want to add another one to the mix. Who knows what they're going to say? But getting to the bottom of why they don't want to take it is going to help you in the long run, because it might be a simple objection you want to overcome. Maybe the pill's too big for them to swallow. They're having trouble swallowing it. You could say, well, I can't crush this pill up because I don't have any sort of like directions to do so, but why don't we try taking it with some food? Maybe we can put it in some pudding and you can swallow it with some pudding and it'll go down easier. Now that's a common thing that'll help medications go down easier, is just swallowing with a nice creamy food. Okay? So there's ways to fix it if you know the problem. Now sometimes they don't want to take medications because whatever reason they come up with, and instead of refusing the medication, they'll simply hide the fact that they didn't take it. They'll store it in their cheek and spit it out later, or they'll pretend that they took it and they'll hold it in their hand and they'll throw it in the garbage. They'll pretend they're taking it. Now, if they fool you and you're not, and they're not taking the medication or throwing it away, I can't hold you responsible for that. Your job is not to play correctional officer and swab their mouth with your finger and make sure they swallowed it and everything. All you can do is take them on their good faith that they took the medication. However, if you later find out that they're not taking it, like you find like 6 pills in their garbage can when you're emptying their garbage can, or you find pills stuffed under their mattress or under their pillow or something, then when you find out they're not taking the medication, then it does become your responsibility to do something about it. You talk to the client about it and you report it accurately so that people know that it's going on. All right? So that's all that's expected of you, is to act in good faith and to, do your due diligence. And if you've got no solution as to what's going on and they're just simply refusing to take it and won't tell you why, all right, you just report it to the appropriate person in your care setting, document that they didn't take it and how often they're not taking it, and to the best of your knowledge, why they're not taking it. Okay? Whatever information they give you, but remember to be objective, not subjective. Don't make up something, because when you make up something in a report, people expect objectivity and they'll think what you made up is the reason. Like if you say, oh, they didn't take the medication and it's likely because the pill's too big, then the doctor might see that as, oh, yep, that's why they said it. And then they're going to go about trying to solve that problem when that might not be the problem at all. It's just your guess. So only objective data. All right. Over here are some common reasons that you'll see that people say they don't want to take the medication. And you've got the unpleasant taste, which, like I said, you can do maybe with food, ice. Maybe the doctor can get a different form of medication that doesn't have that kind of taste. Then you've got the side effects, of course. That's a really common one, because side effects can be just nasty, can't they? So again, that'd be something you'd bring up with the doctor and maybe see if they can get a different type of the same medication that might not have the same side effects. Or sometimes they take, instead of a regular release, they take an extended release, so it doesn't all get in the system as quickly and the side effects are less severe. Lack of understanding. Sometimes it's as simple as, I don't know why I'm taking this pill. And you're just there to simply give them a gentle reminder about how it lowers their cholesterol or it manages their blood sugar. They may deny they need it. They don't want it. They don't need it. I don't need this stupid medication. I'm not taking it. Oh, okay, if they're fighting you on it, don't get in a battle with them. Just say, okay, I understand your feeling on the matter. I'll let your doctor know how you feel. Then you let your supervisors and the doctor know that they're not going to take it, and then it's the hill they want to die on, And finally, there could be background or cultural reasons. Sometimes people have an anti-whatever kind of medication it is. They might be anti-medicine, anti-pharmaceuticals, anti-homeopathy, anti-vaccine, anti-whatever. People have their own beliefs about what medications do and don't do and where they come from and what's in them. You've seen all the posts and the Instagrams and TikToks and Facebooks about the wacky stuff that people, think is in medications. So, people believe this. And if they believe it, you're not going to convince them otherwise. They say the sky is green. If they really believe the sky is green, you're not going to be able to convince them it's blue, no matter what evidence you present to them. So you just go, okay, if this is how you feel, I respect your beliefs and I'm not going to fight you on it. You let the doctor know, you let the case manager know, and you let them handle it. It's not your job to battle these people on their meds. All right, that's a pretty good place to take a quick break. We'll start off at the next section on reporting errors on page 246. See you in a minute.